I'd like first of all to thank the Nestle Nutrition Institute for this opportunity. I'd like to thank everybody that is joined this session with us. And especially I'd like to congratulate Dr. Eline and Dr. Jean-Charles for this very, very interesting presentation. So let's start our Q&A session. And I have some important questions here. I'd like to start the question with Dr. Eline. And there is a question here that could you please suggest on how to evaluate protein and fat quantity and quality in breast milk? Should we do free amino acids and fat acid estimation in breast milk?
It's a very interesting question to start with the composition of breast milk. I think some of the longitudinal studies that assessed breast milk composition over time have actually taught us that the breast milk composition for protein, both in terms of quantity and quality, changes a little bit, but shows more differences between women than within a single woman, which also then indicates that doing assessment of protein levels and quality that are tightly regulated by the maternal metabolism doesn't make so much sense. I think it's slightly different if we talk about fatty acids, because there's an important contribution of the diet there, especially the levels and the contribution of long-chain polyunsaturated fatty acids is for large part determined by the diet that the mother eats. So this is something that could be influenced in the breast milk. You could, of course, measure the breast milk. You could also think about doing dietary assessment to see if there might be an opportunity to improve the composition of breast milk in mothers.
Okay, thank you very much. Dr. Picot, I have a question here that I think it's very important. I read it for you. Some studies have shown that lack of breastfeeding, portion size, the high protein level in infant formula are factors in the first 2 years of life that can influence health of children. Do you think that doctors should be more proactive in advising parents on proper nutrition, most especially that in many cultures, and here in Brazil we have this problem, the overweight baby are desirable. How do we debunk the belief that adiposity in children can be outgrown?
An interesting question, because it's very important that the doctors advise carefully the parents around this question. And probably the first point, there are few, not that much, but few crucial points about the breastfeeding and the breastfeeding duration, and what to do when breastfeeding is not possible, by using the appropriate formula instead of, for example, co-milk, which is been shown to be providing too much protein. Then the advice, when you go on the mid first year of life, the question about the complementary feeding should be correctly advised also, because about the timing, we don't have that much data about the type of complementary feeding food, which doesn't seem to have that impact, but it should be appropriate and do not have excess in such or the other nutrient. But the timing of the complementary feeding, not too early, between 4 and 6 months, is one thing that should be done. And the other part is just about the after the first year of life. Then it's a question of the family nutritional practice, and then how the parents are careful about nutrition, their own nutrition, and which has an impact on the nutrition of the baby, and be careful about not to favor the sweet and salty flavors in these infants. These are fundamental way to advices to give to the parents. And then for the question of overweight babies, it's I think in France we have this health book where you have curves, reference curves about weight, length, head circumference, and BMI. So I think, I don't know if in other countries it's available for parents, but the idea is to inform the parents about this importance of monitoring these reference values, and to be sure that the kinetics, the trajectory of the growth, including the BMI, is not going too high, and make them understand. And it's very easy when you look at these type of curves that being overweight early in life is not beneficial. And we have some data about that, and Aileen said that in our talk about the impact of being overweight at the early life and later obesity.
Okay, it's perfect. I totally agree with you. It's very, very common that we receive at the offices some children that the pediatricians say, yeah, you need to go to a pediatric specialized in nutrition because your baby is overweight and obese. And the parents come to us and say, I do not agree with this. And so we can show the growth charts with the BMI and the cutoff points defined by World Health Organization and say, okay, look at here, look at this graph. So I think it's important. Thank you for your answer. There is a question here that was directed to Dr. Aileen, but I think you both can help us. Are there any robust multiplexing methods available for protein and quantity and quality estimations?
So me first, perhaps. I think what we know, if you want to know to the level of detail that we talk about, so also contribution of individual amino acids or fatty acids, unfortunately, I think you need quite reliable methods. And I think if we still talk about breast milk, it is important to realize that indeed the composition of breast milk changes slightly over a feed, but is also different over the course of the day and over the course of lactation. So you need to understand the material that you start with from an analysis point of view. And I think to go to the other end of the question, from my point of view, it's really important to also say that if we talk about protein quality, we talk about the contribution of essential amino acids in the milk, because those are amino acids that are not needed as building blocks in the body that we cannot produce with our metabolism ourselves. I think what we're trying to hit here is the right amount and the right composition of these essential amino acids, not too much, not too little. And to find this sweet spot, I think we also still need to understand better how the total amount of protein, but also the contribution of specific amino acids contributes to the way that children grow, and how that then can help us to understand that we actually set up children for healthy growth and not to develop excess adiposity. So if we look at the methodology, I think there's a lot that we can currently do, but I think what is important is to remember what you do the analysis in, because your starting material determines also in part your outcomes, is my opinion. Jean-Charles?
Yeah, it's I can just, we are discussing about the healthy term baby. So for me, there is no real indication in practice about measuring the milk quality. And I think it should be underlined, even if it's obvious, because there are some marketed devices we are going to be sold now to the parents. And so it could let them understand that the milk, human milk, could be not that good quality. And you said very well that measuring the milk at one time is not a reflect of what happens, and what happens is what happened during days and days. So and the summary of all that is finally good for the baby, and we know very well from the growth studies that breastfed babies are growing well. So I think in a clinical context, it's not really relevant to measure that, except for the preterm babies, as we show that sometimes you need to measure the gross protein quantity or energy quantity in the milk. But it should be done with these infrared devices, which have been validated and these type of things. But it's the only place of this routine measurement of milk composition that I can see here. But once again, we should be very careful about this question, because the milk quality and quantity milk quality is we should be considered always as optimal in infants, except for some specific clinical context.
Okay, thank you very much. Dr. Eline, I have a question. My question for you. Here in Brazil, we are working a lot uh, on the idea that the pediatrician should be present at the prenatal period, but also in the preconception period. But when we say to the pediatrician, please stay with the mother in the and with the father in the preconception period and the prenatal period, and they say, "Oh, I don't know what to say. I don't know what to talk with mothers and fathers at this consultation. Could you help us? What would the pediatricians have to talk with mothers and fathers when they are discussing about the baby, about how to feed the baby, but during this preconception and prenatal period?"
This is this is an interesting question, I have to say, and something that I think keeps on puzzling a lot of us. The way we've organized our medical community, obviously the mother and the father would probably first see an obstetrician or a midwife and only later get in contact with the pediatrician. So it's like these different periods during the first 1,000 days are actually, from a medical point of view, almost separated. I think now that we start to understand that also maternal health and nutrition have such an important contribution, but in fact also maternal health and nutrition before she becomes pregnant, and the health and nutrition of the father, because it determines the starting point of the first 1,000 days. So I think what is important and what is starting to happen is that there should be more education on the first 1,000 days, but especially on the role of nutrition for the father and the mother, and how that contributes to the overall period of the first 1,000 days. It requires perhaps for a slightly different way of thinking, because it means that if we talk about what can you do or what can you say to the father and mother, lifestyle and understanding what a healthy diet is, and that nutritional needs are different for a man and a woman and for the child during different life stages, should become the center of focus. And I think we're very far away from that today. I don't know if Jean-Charles has any other advice. For me, it would be my wish for the future that we try and integrate different medical disciplines a little bit better, and that we increase the contribution of education on nutrition and lifestyle for people in the medical community.
Okay, unfortunately, I received the information that our time is ended, so I will have to finish this very, very interesting meeting. I'd like to thank very, very much Dr. Eline and Dr. Jean-Charles for this opportunity, and I hope you all have a very, very nice meeting till tomorrow. Thank you very much.
Thank you very much.
Bye.